Hey there, this is Dr. Jim. Hope you're having a great day. This episode is all about PDMD. Do you know what those letters stand for? It's the patient driven payment model. And it's coming soon, really soon, as a matter of fact. And change is the name of the game in senior care. And change is coming again. The patient-driven payment model is being implemented on October 1st, so get ready. And like the effects of most change in our industry, many people are worried about it, they lose sleep over it, they have to learn it, and we just don't like all of this change that's occurring. But it's important to know. So they're worried about the implications that this new system specifically is going to have on therapy. First, the good news. Therapy isn't going anywhere. It's here to stay. Like other tides of change have come and gone in senior care, we're going to survive just as we have with other previous payment model changes in the past. So the not so great news is that PDMP represents a huge change. It really does. And everyone is going to have to learn about it. Everyone's going to have to accept it and get on board ASAP, ASAP, because it is going to affect reimbursement in therapy. So there is an evolution in therapy. Many changes have occurred in therapy practices and reimbursement. Change took place under the RUGS system as well as the prospective payment system, or PPS. I have a very dear friend who went around multiple states talking about PPS because she mastered the program and she went out training a lot of people on it. And the first time I ever heard her talk about it, she said, PPS, please pay something. And I thought that that was pretty funny. So under PPS, though, providers were incentivized to adapt, balance, and focus on multiple areas, including resident satisfaction and running a good therapy business. That's what it's all about. So over the past several years, therapy services have seen an incredible increase in usage. And some experts say that the increase in usage across therapies in the US has gone up by 30%. That's huge. This occurred in the ultra-high rehabilitation, or the RU category. And with it came program development, employee training, and allowing residents as much therapy as possible. Over the last 10 to 15 years, residents with more acute and complex conditions have been the norm. And I've seen that over the last decade or so, for sure. To make this happen, senior care leaned heavily on therapy, and of course, we're very concerned about therapy outcomes. So the residents got therapy, they went home safely without the need for rehospitalization, which was extremely good. So now PDPM, will therapy survive? Therapy will evolve again with the changes taking place under the new patient-driven payment model. This time there will be a greater focus, though, on the residents' clinical needs and the use of technology, the employment of more therapists who have a doctor of physical therapy, which is a DPT degree. And I have a nephew that's doing that right now down in Florida. It's a great degree to go into, by the way. And greater use of group and concurrent therapy. As in the past, though, this will be tied to clinically appropriate interventions and related outcomes from all treatments under therapy. So, my question is, will therapy survive under PDMD? Yep, I'm Dr. Jim. That's all I've got. See you soon.